Alright, hello everybody. Today I'm going to go over the Glasgow Coma scale. So this is GCS for short. So the GCS is a scale that assists us in determining a patient's level of consciousness. So pretty much their level of arousal and their cerebral cortex function. So the GCS relevance to neuro rehab is that it allows us to define and classify the severity of this brain injury that this patient has gone through and monitor its changes as they either progress or maybe don't progress. It has a high predictability of prognosis and how they're going to recover and if they're going to recover. There have actually been numerous studies that have linked a low initial GCS score to predicting a pretty poor recovery, unfortunately, but it helps us to determine the prognosis. It is useful for us because it allows us to determine how we should approach treatment, what interventions we should and shouldn't do, and how we should go about treating these patients, either how we teach them, what we do, so like you wouldn't use complicated directions with someone who scores low and vice versa. You wouldn't need to use super simple instructions if they had a high score. Essentially, this goes pretty much also back to safety. You want to be safe with your patients, and knowing their level of consciousness will help us give that treatment in the most safest way possible. So the GCS is recommended by the APTA as part of the initial assessment, also to monitor changes as we previously mentioned. The APTA says that the GCS is used with TBI, cardiac dysfunction, pulmonary disorders, stroke recovery, and any type of acute trauma patients. So in class, I've only really seen it talked about with TBI, but the APTA says it can be used with that. I'm assuming anything where consciousness is affected, it would be a good scale. So, the Glasgow Coma scale, I have a picture of the scale here in green on the left. It is divided into 3 categories: eye-opening response, best verbal response, and best motor response. So when administering this test, it's pretty much about what you observe when you apply the stimulus. So you're going to apply a stimulus, and the stimulus is going to be either verbal or it can be physical. Physical way could be like this: fingertip pressure, trap pinch, or at the supraorbital notch. This is from the GCS website, so this is what they recommend. And then you would rate their response. You would jot down the highest response that you observe with this patient reacting to the stimulus you provided. So let's go over this scale really quick. So I'm going to ignore the ones since they're all no response. So let's start with eye opening. I like this little chart. It's how I remember eye opening has only 4 scores. It says eye opening 4 eyes. So a little trick to help you. So on number 2 would be to pain. So this means that you would apply a stimulus. You either do the fingertip stimulus or the trap, whatever you want, and they would open their eyes. A 3 would mean that you shout or speak a request, and then that would cause them to open their eyes. And a 4 would mean that their eyes are probably already open before you even apply a stimulus. So it's just spontaneous, doesn't need anything to cause it. For verbal, a 2 would be incomprehensible sound. So this pretty much means that after a stimulus, they would just probably groan or moan. And a 3 would mean inappropriate words. So they are now saying words, but they're intelligible single words, so don't really make sense. A 4 would be confused. So this time they're actually communicating fine, but they are just not oriented. So whatever you ask them, they'll reply with something completely irrelevant. And a 5 means that they're oriented to time, place, and person. So you ask them a question, well, probably assuming you ask them about time, place, and person, and they would correctly give you their name, where they're at, and the correct date. For motor response, a 2 would mean abnormal extension reaction. So they would show in a decerebrate position. So I have here in the orange picture, the bottom right. That's how they would react. They would adduct, extend their elbow, and flex their wrist to the pain or to the stimulus you apply. For 3, it would be an abnormal flexion or decorticate reaction, and that would be arm adducts, elbow flexes across the chest, wrist is flexed. 4 would be a flexion withdrawal from pain, so this would be a normal flexion reaction, like this, where the arm would abduct and or they would just withdraw from the pain. A 5 would mean they move to localized pain, and that means that wherever you apply the pressure, they would go towards that spot, like in the picture in the orange where it says localizing to pain. They're applying a trap pinch and they're going to the pain instead of, reacting in a generalized way. A 6 would mean that they obey commands, so you can verbally tell them, hey, can you raise your arm, and they would be able to raise it. So once you get all the scores, you will add them up. 8 or less would be a severe TBI or a comatose patient. 9 to 12 would be moderate, and then 13 to 15 would be mild. And then obviously 3 would be totally unresponsive, as it would mean that they got a score of 1 and everything. So I had shown you guys this chart. I really like this scale picture. If anyone needs to study it, this is what I use when I study the GCS for the test. I literally see these little stick figures in my head when I'm taking the test, and it's really, really helpful. The GCS is an awesome little scale because it requires no equipment, no special training. You pretty much just apply stimulus and record your results. And it is no wonder it is called the golden standard for determining a patient's level of consciousness. Thank you so much for listening.